In 2015, Rachel Czarnecki's life was forever changed by a workplace accident. At just 19, Rachel stepped into the fast-paced world of nursing. Determined, ambitious, and ready to make a difference, her passion for healthcare and education pushed her further. While most were still finding their path, Rachel had already carved hers. By 24, she wasn't just saving lives, she was shaping them. Teaching in the healthcare assistant program, she poured her knowledge into the next generation of caregivers, never imagining that, one day, she would need that same care herself. Then, in an instant, everything changed. At just 26 years old, she was struck on the head by a heavy metal mechanism while working in a hospital. This traumatic brain injury set off a chain reaction of hardship. And due to multiple system failures and lack of support for brain injury awareness in the organizations like WCB, unions, and government agencies, Rachel was left to navigate the complexities of recovery, advocacy, and survival on her own. After her injury, Rachel's attempt to resume work through a graduated return-to-work program failed due to the severity of her condition. She was often deemed non-compliant as she struggled to keep up with the demands of the organizations that were supposed to help. Within months, her short-term disability benefits ran out, leaving her without income, resources, or a safety net. For 3 years, Rachel faced homelessness, living out of her truck while battling a system that failed to recognize or support her needs. Rachel's story is, unfortunately, not unique. In Canada, a brain injury occurs every 3 minutes, affecting over 165,000 people each year. BC reports approximately 22,000 new brain injury cases annually, equating to about 60 new cases daily. Over 180,000 residents in BC are currently living with mild to severe acquired brain injuries. Lack of accessible help leaves many survivors grappling with homelessness, social isolation, unemployment, and mental health challenges. Brain injury associations are a lifeline for survivors. The turning point in Rachel's journey came when she connected with the Fraser Valley Brain Injury Association. With their help, Rachel gained access to case management services, which helped her navigate the complexities of multiple claims, regain stability, and build a path forward. But even with support, Rachel had to rebuild her life from scratch. Forced to abandon her nursing career, she embarked on a new path in occupational health and safety and emergency preparedness. Over the years, Rachel completed extensive cognitive rehabilitation on her own, earning over 200 certifications and 5 diplomas to redefine her purpose. When Rachel and her husband, Daniel Moroz, relocated to Red Deer in 2024, she quickly recognized the gap in services for brain injury survivors in the region. Drawing from her lived experience and the transformative impact of organizations like the Fraser Valley Brain Injury Association, Rachel and Daniel founded the Brain Injury Association of Red Deer on November 19, 2024. Why British Columbia needs the Fraser Valley Brain Injury Association. FVBIA envisions a community where individuals with brain injuries are supported and included, with a strong emphasis on the prevention and reduction of brain injuries. In 1991, FVBIA began as a support group for individuals with acquired brain injuries and their families in Chilliwack and later in Abbotsford, facilitated by John Simpson, a renowned case manager in the field of brain injury. By 1997, the support group members formally established the Fraser Valley Brain Injury Association. Survivors often face significant barriers to accessing care, including bureaucratic red tape, limited funding, and a lack of specialized services tailored to their needs. Without adequate support, brain injury survivors are at a higher risk of homelessness, unemployment, addiction, family breakdown, poverty, and social isolation, placing additional strain on healthcare, housing, and justice systems. FVBIA exists to address these gaps and empower survivors of brain injuries in the Lower Mainland. FVBIA offers case management, helping survivors access resources and reintegrate into the community, support groups, children's activities, education and prevention initiatives, creative arts and photography programs, health and wellness support, and a corrections liaison program. These programs create safe spaces where survivors can connect, share experiences, and combat isolation. Raise awareness and educate the community. Lobby for systemic change to improve access to care and prevent long-term hardship by intervening early to reduce the risks of homelessness, unemployment, and mental health crises, along with other issues faced among survivors. FVBIA understands the physical, emotional, and financial toll survivors and caregivers endure. They are here to offer a support system that fosters hope, resilience, and recovery. Support your local brain injury associations. Together, we can make a real impact. Community, awareness, and support are key to recovery. Let's stand together and make a difference. For more information, find us at www.fvbia.org or visit www.brainstreams.ca and www.braininjuryalliance.ca to find support.